Okay, well, let's look at what people are doing to help during this current health crisis. Regent Business School will use its hubs to produce reusable protective face shields and splash protection masks using 3D printers. All equipment will be distributed at no cost to public healthcare facilities. Now, this is part of an effort to fight the spread of coronavirus in the country. I'm going to discuss this now with the Managing Director of Regent Business School, Dr. Ahmed Sheikh. Dr. Sheikh, a very good morning to you, and thanks so much for your time. So you are going to be using digital innovation, as we just described in brief. They give us more details as to how you're going to be doing this and using this to help fight the spread of COVID-19.
Sure. Thank you, Yuveka, for the opportunity. Essentially, what we've done, Yuveka, with the splash masks, etc., is that we've used rapid prototyping technology, 3D printing, which most of your viewers are probably very familiar with, and we've used that to 3D print parts of the face shield and splash masks. And we're putting that together with some acetate paper and being able to roll this out as PPE to frontline doctors, especially in the public healthcare facilities.
Well, that's fantastic. So just tell us a bit more about those who don't know what 3D printing entails. Obviously, does this limit the amount of human contact that you have with the materials that you're using and producing?
Yeah, I guess it's an effective, agile way to be able to print on demand. 3D printing allows us to print on demand in a short space of time. We don't have to have large-scale production. We're responding to an emergency, a global pandemic, and I think 3D printing has been extremely convenient for us to be able to supply PPE, as I said, to public healthcare workers.
Tell us about the distribution. You say that it'll be at no cost to public healthcare facilities. How are you managing that then?
Sure. Our main focus is to reach frontline public healthcare workers, doctors, nurses, and other persons dealing with COVID-positive patients or in testing sites, etc. And we want to help them sort of protect themselves from picking up the infection. We're doing our bit to flatten the curve. So we've chosen to do this as a donation from our business school and from our innovation lab, specifically for public healthcare workers.
All right, Doc. And how quickly are you able to produce any one of these items using 3D printing?
Yuveka, essentially, each face shield takes roughly an hour, just under an hour, depends on the design, to produce. We could produce a few hundred a week, and we've done a few hundred in the last week and donated them to public healthcare facilities in Durban, Johannesburg. We're doing some in Cape Town next week. We're doing some in Pretoria this week as well. So I think that given the circumstances and the kind of technology we're using, we're able to respond reasonably quickly with emergency PPE. And because of the lockdown, you don't have manufacturing facilities available. So I think that this is where technology has been really convenient for us to deploy PPE in the shortest possible time.
That's fantastic. And I mean, I would imagine that this would be much easier to use than the other masks that people are using. I mean, we're seeing all kinds of problems as to whether those can be used again. And I see that what you are producing is reusable. So this is something that could go a long way.
Absolutely. I mean, as your viewers are probably aware, this is a global shortage of PPE. We're seeing it all of the time around the world, etc. So ours is, yes, reusable. It needs to be disinfected after a few uses. I must say that, Yuveka, this is called adjunctive PPE, which means it has to be used in conjunction with other PPE equipment. So in this case, our face shield will probably be used with an N95 mask or a surgical mask. That is a one-use item, but ours is reusable. And we're doing this to make sure that healthcare workers don't run out of PPE, which is essential for themselves and the patients that they are treating.
Absolutely at this point, especially if you consider what's happening at some of these facilities. Doc, now, very quickly tell us, how many people are involved in this? And I see that you're doing this, it involves 3 phases, this plan of yours. So who is on your teams and how are you sort of making all of this happen together?
Sure, thanks. So I think there's quite a bit of collaboration. In a direct way, we've got academics and staff and volunteers in the Regent Business School in our labs across the country in all of the major centers. But there are many people around the world, Rebecca, that are in some way or the other involved with us because, as you know, this has been a period of tremendous amount of innovation and tremendous collaboration around the world. A lot of these designs are open source. They're uploaded, you're able to download them for free and produce them. So I think that in a direct way, we've got a few dozen people around the country working throughout our labs. but also globally, to be fair, there's a whole community of engineers, doctors, scientists, makers, hobbyists, and other people just wanting to make a difference in flattening the curve, as they call it. So I think that there's people involved in South Africa across the Regent Business Schools network, but also people across Africa. We're part of a Pan-African platform of universities called Honoris. And so we've got colleagues in Tunisia, Morocco, Nigeria, in West Africa, people who are contributing in one way or another. For example, Rebecca, you may be keen to know that our partners in Tunisia have been part of a project which has developed a ventilator or a breathing assisting machine. And in Morocco, we've developed a drone that is able to deliver swabs, remotely to remote villages and rural areas. And this, again, minimizes contact between doctor, patient, healthcare worker, patient, etc. So there's quite a bit of innovation happening globally, and lots of people around the world are collaborating in a very open source way, which is fantastic to see.
Indeed, fantastic, Doc. And I'm guessing that you're going to be much busier after this particular interview. Now, people wanting to get a hold of you, the need out there is quite desperate. How do they get a hold of you?
I think our website would probably be the most convenient and direct way to get in touch with us, Rebecca. So it's www.regent.ac.za.
All right, let me just repeat that, www.regent.ac.za, if you want to get in touch with Dr. Sheikh and those who are involved in this fascinating and vital project. Thank you so much for your time there.